Well, now I'm going to show you how you perform a multi-layer bandage. And these kind of bandaging techniques you use for lymphedema patients, for severe venous dysfunction, and also for the lipedema patients. When you start bandaging, you need to cover the skin for the patient. And we have the first layer. We need to see how much I need. Usually, you need 1.5 length of the patient's leg. Sometimes it works, sometimes I have to redo it. But we start with this one. You always need to look into that the leg is clean. And when you do bandaging or wearing bandaging during day and night, the skin gets very dry, so you need to moisturize the leg before you start bandaging. And this my patient has already done, so it's fresh and moisturized. And then I've put the first layer the whole way up to cover the thigh and up in the groin, and I leave some material on the upper side and on the lower side of the leg. Now I uncover, because when you do this kind of bandaging, you need to bandage the toes. And why do we do this? Because if you have a swollen legs, you need to have the pressure already from the toes and on the foot and on the way up. So you start on the toes with the bandaging. And we have a small bandage with 2 centimeters for the toes, and it's very transparent and it's very soft, and you should do this very carefully. You have to have in mind that when the patient is coming up and standing, the blood will come into the foot, and therefore it will strengthen the bandage. So what I do, I anchor around the base of the toes, and then I start distally on the toe. I leave a little bit of the toe so I can see if it's too much strength on the bandage. So I still want the patient to have the blood circulation and the nerves functioning, and I'm also aware of that I don't stretch the bandage too much. This you can do in the morning when the patient stands up, and you can actually leave it for days. My patients, I teach them actually to do this themselves, so they don't have to come to the clinic every morning to do this. And if they have a very nice spouse, I always teach the spouse to do it for them. So you can see it looks very nice and not too tight for the patient. And this also separates the toes a little bit. And what is the purpose of having them separated? Well, usually when you have an edema, you can get fungus between the toes. And therefore, when you bandage the toes, you actually help the fungus to go away after cleaning the foot. So, you have to see too that the area between the toes are okay, the bandage not too hard on the base of the toes. And then I very carefully just leave the bandage under one of the layers like this. Then I take the material over the toes because I'm going to use this later on. Now I need the next layer. Here you can choose between 2 layers. I'm going to use the soft material. The cotton material comes in a roll, and this does not give any compression at all. I start at the base of the toes and I just do the circles twice on the base of the toes, and then I continuing with a spiral around the ankle, the heel, and upwards all the way. With no strength at all, I just see to that I have an overlapping of 50%. Then I reach the knee. Just leave it, and I take the next one. Starts here, continuing all the way up, under the knee, over the knee, and the overlapping is 50% here. And when I reach the thigh and the genital area, it should be sufficient of material to stop here. So that's my second layer. The third layer is a bandage, short stretch bandage. Why? Because the short stretch is very good for the lymphedema, for the venous diseases, for arterial problems. So we start at the base of the toes, as we did before. I apply the bandages in an angle diagonally, go under the foot. On my second layer, I will press the bandage tip, and then I have secured the bandage here. I can choose here to even do two different techniques. I can use the circle spiral technique, or I can use the figure 8 techniques. So I continue over the foot, and I have over the heel, and now I have to secure the bottom one here. So I stretch the bandage a little bit. And I secure the bottom part, go around and secure the upper part. Now I can choose, do I want the circle here with a spiral, or do I want the figure 8? And I really like the figure 8, so I decide to do the figure 8. Under the heel, coming up again. I have overlapping that is a little bit more than 50%. And why? This is because the skin, the tissue, has a lot of edema, and it also sometimes have a lot of other substances, and we want to reach deeper into the tissue. So therefore, I do an overlapping of a bit more. I'm going to change to my next bandage. And when you change bandage, you have to be careful, because if you do too many overlapping, it will also increase the compression class. I put it diagonally because I don't want anything to show on the bottom part. It's secured. Please bend the knee. And then I just stretch a little bit, go down, stretch a little bit, upwards. Stretch a little bit, coming down again. And here we have a change of volume of the leg. So I can either go 50% overlapping here because the volume changes and I have to stretch the material, coming up. And then we have to secure the knee area. So just before I reach the top of the knee, the patella, I strengthen the bandage, comes around, goes over on top of the patella, and to secure it, I need to go down, stretch the bandage, and then turn going up. Stretch the bandage. Stretch properly, because we have a bigger volume in this area than we have down on the knee, on the leg. Over, under. Now I will change to have the spirals, because now I can stretch the bandage on every centimeter that I'm using. Because of the volume is much bigger in this area, I need to stretch it all the way to have it fitting properly. Please, thank you. I need to get quite high up. So if you please hold this part there and step aside to stand on the floor. So now I have the patient standing, and there are a few things I need to do to complete the bandaging. First of all, I need to open up the first layer to see how the feet reacts. I press it for 5 seconds and I see that the color comes back immediately, so it's well done. It also, when the tissue is very soft, you have to be very firm when you do the bandaging, but you also want it to stay on for the whole day, for a couple of days, and then you have to put some extra material on top of this. I have used the short stretch bandage all the way, but during daytime, when the patient is moving around and the edema decreases, it might start moving with the short stretch bandage. So on top of this day, during daytime, I start near the ankle and I have the high elastic bandage, because the high elastic bandage has a high resting pressure, and it also makes the underlying short stretch bandage to stay where it is. If the patient is going to sleep with the bandaging, they have to take off this high elastic bandage, because they are not supposed to sleep with the high elastic bandage. And I teach the patient to do this, and it's usually no problem at all. I also want it to stay, and this area is much larger than the rest of the body. So I need to have a high elastic or a low elastic bandage to make it stay, and therefore I will use the tummy and the back area to make it stay for the patient. So I have the extra layers, 2 extra layers on the leg, and then I go up on my way over the back, over the hip on the other side, over the tummy, going back, look into the back so the gluteal fold is not pressed, and after that I can fix that bandage, and if needed, which is usually, I can do the final bandaging. Whoops, this is what happens sometimes. So I was not so good. I should have taken 2 of the, like this. Okay, we start again. Under the gluteal fold, please stretch the bandage properly, over the tushy, again over the hip, over the tummy, back again, cover as much as you want, and you end the bandaging with 2 circles, and then you use the tape to fasten and have the final of the bandaging like this. Please try to bend the knee. Very good. And to move the foot. Very good. How does it feel? Is it okay? Good. This is a very tight, very firm bandage, but it will absolutely reduce the swelling and it will enhance the venous circulation and the blood circulation, and it will help the lymph liquid to be moved to another part. Thank you.